That is such a big question with such a long answer, but I will try to make it short. PTSD is post-traumatic stress disorder, and that is usually based on a single event that occurred that your body stored as a traumatic event. So a car accident, a surgery, a robbery, something like that, that every time your body thinks that thing is happening again, your nervous system predicts it's happening again, it's going to have a reaction. That's called a trauma trigger. cptsd is complex post-traumatic stress disorder. And that is not technically a diagnosis in the DSM-5. However, it has been defined as an ongoing traumatic scenario, usually in the interpersonal realm. Often it occurs in childhood, and it's something that you're unable to escape from that occurs long term. So your body and your nervous system learns how to react and how to behave based on this continuing trauma situation. It can also happen in adult relationships with emotional abuse or narcissistic relationships. The reason that many neurodivergent people develop cptsd over time is because as a child, your sensory sensitivities and your perception of the world was often mislabeled by those around you. Or maybe you faced lots of recrimination, you were picked on a lot. It's been said that people that have ADHD have received more than 20,000 more than their neurotypical peers negative messages in their childhood. So being in a repeated scenario of constantly being told that what you're thinking or what you're feeling is not correct, or you had emotionally unavailable parents, or you had an abusive household, that's like a worst case scenario, alcoholic or a drug addicted parent, these things can all cause cptsd. And when you have a nervous system that is very sensitive and perceives things much differently than those in the world around you, it's kind of hard not to develop a complex post-traumatic stress disorder. And cptsd is not something that you recover from in one session or one visit to a therapist, nor is it something that exposure therapy often helps with. But having an understanding of your nervous system individually and how it operates does help you to recover and adapt better in the world as you live in it today. Hope that answers your question.